All right, so we are back live. Senate Health and Welfare, and now we're looking at, and we're able to put up on the screen, JRS 44 with Ledge Council. So Michael, thank you for being here.
And I will start where I began a few moments ago before the break. My name is Michael Chernick. I'm from Legislative Council. I'm the drafter of JRS 44. As a preliminary comment, which Senator Hardy did not hear, but the rest of the committee did, you as a committee had made several requests of me, which I incorporated in this draft. But in the process of doing this draft, I also took a good long look at it. And I realized that 95% of what was being discussed dealt with opioid related situations. And maybe 5% was non-opioid. And many of the figures I had were opioid. And then there was this tiny asterisk, by the way, there's this little extra piece for non-opioid. And I thought it made a whole lot more sense. All the discussion has been about opioids, not non-opioids, that I just focus exclusively on opioids. So I did make some changes on that score. And I ran them by Katie McClinn, who's the policy person on our staff who normally does drug-related issues. And she said, absolutely, it's fine. So with that, to be aware that you'll see some language that's more opioid focused than you initially did. And in addition to answering all your questions from the meeting we had a few weeks ago. And with that, let's proceed forward. This is JRS 44 entitled Joint Resolution Declaring the, and I did change the title at the end as well, as you'll hear in a few moments. Joint Resolution Declaring the increased number of drug overdose deaths in Vermont to be a public health emergency. Respectfully reports that it has considered the same and recommends to the Senate that the joint resolution be amended by striking out all the whereas and resolve clauses and insert the following. You'll recognize much of it, but just as another procedural point, it's simplest when I'm doing this type of thing with a res, just to strike out all the clauses and do it fresh. Because otherwise, whoever your reporter is on the floor is going to have to say, well, the next three clauses, if you go back in the journal or out, it's just cleaner this way. Okay. So with that, now let's actually do it. Whereas the continuing and expanding use of opioid-related drugs in Vermont, regardless of their source, has led to an increasingly severe crisis that has killed far too many Vermonters. And whereas the victims are not only the individuals who die, but also their families and friends, creating a broader human tragedy. And whereas Department of Health, the department data reveal the severity of the situation. And whereas the number of Vermonters who have perished due to opioid-related drug overdoses grew from 37 in 2010 to 212 in the first 11 months of 2023. That, by the way, is the latest data that I can find from the department. Excluding those deaths deemed to have been by suicide. That's something Katie McClinn reminds me of all the time, that this does not include suicide and to be included. Good to know that in the rest. Whereas the opioids causing these deaths are now more toxic than in prior years, as fentanyl, a synthetic opioid that is 50 times more potent than heroin, was involved in 94.8% of the opioid-related drug overdose deaths recorded in Vermont for the first 11 months of 2023. And whereas other opioid-related drugs contributing to overdose deaths in this time period include cocaine 58.4%, heroin 3.7%, gabapentin 10.8%, methamphetamine 5.6%, and Xylem, which the FDA has only approved for veterinary use, 32.07%. And whereas the rise in the number of opioid-related drug overdose deaths is occurring despite the existence of extensive state and federally funded treatment services, and these services are clearly insufficient for reaching all individuals experiencing a substance use disorder. And whereas according to a 2020 social autopsy, the department documented that 76% of the Vermonters who had died from an accidental drug overdose had no known history of accessing treatment. And here's the national clause that you had talked about. Whereas the severe problems associated with opioid-related disorder in Vermont, which also exists nationally, show no signs of abating, and the implementation of more effective solutions is an urgent state imperative. And I wrote that clause based upon the discussion that I heard in committee, and I thought that's where you wanted to go. Not starting to give national numbers, but to say, hey, we're not alone. Resolved, now therefore be it resolved by the Senate and House of Representatives that the General Assembly declares that the increasing number of opioid-related drug overdose deaths in Vermont constitutes a public health emergency. And I changed that to constitutes, it just sounded better. And be it further resolved that the Secretary of State and Director to send a copy of this resolution to Governor Philip P. Scott and Commissioner of Health, Dr. Mark Levine. And after passage, the title of this resolution shall be amended to read joint resolution declaring that the increasing number of opioid-related drug overdose deaths in Vermont constitute a public health emergency. And there is the draft as it exists right now.
Go ahead.
What was the word that before constitutes? I mean, you changed it to constitutes.
Yeah, I did, that's, I just, yeah, it was is or being, and I changed it to constitutes. To be honest, I just thought it sounded more formal.
Yeah, it does. Yeah, thank you.
Good.
That was my reason for making that switch, was a question of formality, it sounded less colloquial.
Go ahead, Senator.
On the draft, the
What line?
lines 9 through 11.
On the
but
page.
On page 2,
Yeah,
the social autopsy, there's a more recent social autopsy. There's a 2021 one that I just found. And there may be more, I think 2021 is the most recent, but and I'm trying to find in it now, I'm scrolling to see
Is
what
that
the
how you-
updated number is on that, but there's another point that I think would be good to add
sure.
from this social autopsy, which is the percentage of people who die of an overdose alone.
Oh, I like that one.
Yeah, so
Vintage.
and if you, I can email this one. to
Can
or-
would it be embedded right in that one with the 76?
I can just put an
Yeah,
let's put it all
And,
together.
yeah, so, but I'm trying to see if there's an updated number on what you have in there. So it's what
When you
they,
say from an overdose alone.
here, I'll read
They
what
were
it
alone when
says.
they got the.
Physically
In
alone.
2021, 41% of people who died of an overdose were not witnessed using the drugs that led to the fatal overdose, nor was a bystander near during the fatal overdose.
That's a separate whereas, but that's a good one.
Essentially, that 41% of people who died
I can make it sound.
died without anyone else around. They
Right, but I
were
know
using
that it came
alone.
out of the autopsy also reported it. something
Yeah,
like that.
this is from the 21 autopsy, and if you, I'm trying to find the updated number from the,
For that 76.
for that 76 who did not access treatment, how many, that is presence of other people.
Do you have, if you could send me the link to the 21 autopsy, and then I'll be happy to go through it myself in my
Okay.
time. I'm glad to do that.
Okay,
That's good. That'll be good. And then the people who were without anyone. around.
Yeah, and I'll make that a separate
Yeah,
part. I'll just say that the
that's-
autopsy also reports.
Well, and there's a reason, it's critically important in the work that we've just done on the overdose protection sites, there's an indication that when people are around, there's less opportunity for that, and they get some help.
I'm just sending it to all of you.
Yeah, and make sure,
Have
that
Kiki
I'm-
posted up, that'd be great.
but in the
Yeah.
meantime, if you could send it to me
Are
directly.
you?
I'm Mike C.
No, I've got you, Terry K or
Mm-hmm.
TK.
Mary Kay.
TK, okay.
I'm one of the few who has a first name and a last initial because I was one of the original members of the email back in the 90s.
So if you can do that,
I'll make those two changes.
right, and then what's the timing on that, do you think?
Do you want, is this something you, I want to go back and look at it and send it to the
Yeah.
editors. So I would prefer it for not to be, say, in the next 10 or 15 minutes. I'd like. to
No,
look at it
no, no,
pretty
no, no, I was thinking Tuesday, but.
Tuesday's fine.
Alright,
Tuesday is totally fine.
yeah.
Alright, I just sent it to everybody, so, and Kiki.
Yeah, I'm here Tuesday, that's fine.
Senator Weeks has a question.
So I do believe that we may have asked you last time you were in here, we were talking about this topic. What does it really mean to Department of Health and the governor to have declared a public?
It's symbolic.
It's symbolic, we
It's
have,
exclusively symbolic, Senator. I wouldn't make a claim to anything other than that. It's symbolic. A resolution, as I explained, I believe, to this committee or to Senator Hardy's committee, with certain limited exceptions such as internally within the General Assembly and for special provision dealing with state land exchanges has no legal, it may have political or symbolic impact depending upon the resolution, but there's no legal impact whatsoever.
Thank you.
I do have another suggestion, about who we send it to, and I'm wondering,
Sure.
this is for the committee kind of to decide if they want to do it. It's the governor and the commissioner of health. What about the chief prevention officer for the state? That's Monica Hutt. And, if chief prevention officer might be interested in this. Is that, I mean, is that okay if we add that in?
Sure.
Is she part of the Department of Health?
No, she's.
Well, she was in the governor's office, but I think her office is now with the Department of Health, but she is still,
Administratively, she's considered
administratively, she is,
part of the governor's office or
was, yeah.
a little standalone senior, you know. Okay, I can certainly add that, that's, and her name is, and I'll check on the web, but
Monica Hutt,
Hutt,
yes,
okay, that's easy enough to do.
perfect. Okay, anybody else we want to send it to?
Now, Kiki, I will get these to you before the end of the day because I'm going to be working remotely on Monday. It'll be easier if I get them to you now.
It does go into our federal delegation, right?
Not yet.
No, we
Wanted
can
to,
send
we
it to
can.
them, and I was wondering if you'd like to do that. You want
Let's
to do
do
that?
I just noted that, no problem,
Okay,
Awesome, thank you.
good, they should know what we're doing.
Yeah.
no problem.
Anything else on this one? Terrific, all right.
So Kiki, you will have this by the time you leave this afternoon. You'll have this by 3:30
And so we'll be able to look at it.
over the weekend. I will
Yeah.
send it to Kiki and then Kiki can, I will also copy you, Senator Lyons, which
Yeah,
is in my policy to copy, the chair plus the committee assistant. So I will do that and then Kiki can send it out to the rest of you.
Fine. That's great, thank you. Thank you for
You're
your
very
work
welcome.
on this. This is really good.
Thank you very much. You've sent it on, Senator?
I have, but I'm looking to see if, I'm now on the Department of Health website to see if there's an
Something later.
even newer one. But if I find one, I'll send it to everybody, if I find a newer one.
Okay.
I'd
just to be-
So Michael can also, he can go out and look.
I will look as well, but what I'm saying is my plan is to get it to, unless I'm told otherwise, to get it to Kiki by 3:30 this afternoon, so I'm gonna start working on this now for obvious reasons, okay?
Sounds good.
Thank you.
Okay,
Thank you.
You're very welcome.
And thank you, Michael.
Sure.
And before we end, Kiki has some stuff for you. We'll vote on that one probably on Tuesday, so we'll look for that. This, next week, we're looking at two bills that are in economic development. One is on data privacy and the other one is on cannabis. And there are sections in the bill that relate to our jurisdiction, and I've asked from the beginning of the year to be able to look at them in here. So we will have, the data privacy sections are pretty dense, the whole bill is pretty dense. Kiki's giving you the section by section and the bill, so you can take it home. Enjoy your reading, and then the other bill is 612. So that one is 121, H 121, the H 612 has the cannabis language in it. We'll hear some testimony on the cannabis bill a little bit. We'll see what we can do in terms of testimony on data privacy. We'll hear from lead counsel and then we'll sort out how to go forward. Our sections are healthcare data privacy. The S 173 that I introduced is based on the state of Washington and is related to some work that I did off session. And then the bill that we are seeing is more related on Connecticut and California, I believe. So we'll talk with Ledge Council about it, but those are your two little reading things. Okay.
What's the essence of the cannabis bill? What does it do?
The cannabis bill looks at medical marijuana, which is our jurisdiction, and then the conditions under which marijuana might be prescribed for folks needing medical assistance. Then there's a section in there there's discussion about integrating medical marijuana dispensaries with recreational marijuana dispensaries, because the medical marijuana dispensaries right now are not supporting themselves. And yet there is a need out there for some oversight for the types of cannabis and the level of THC embedded in the cannabis for patients. So we'll figure it out.
Did you see my email about the witnesses for that bill that I?
Jim Dumont is
Yeah.
coming in, we got him invited, yeah, I knew that, and then James Pepper will be coming in on that. So we'll make have our discussion.
Great.
So there we go, thank you all, this has been good, been a tough week,
Thank you.
thank you.
I didn't make it.
No, it just wasn't enough. Let's
Just laugh.
wrap.